The Wylie Award is important for development of new treatments because it is given to an individual with great potential but not a long track record. Usually these individuals have great ideas, and a certain percentage of them will turn out to be fantastic and lead to effective and very important new therapies.
As far as career development, there could be no better exposure to the academic vascular surgeon scientist community than the Wylie Scholar Award.
Dr. Starnes also had gotten a notification about the award, and so he had sent me an email saying, "Gale, you should definitely apply for this award." And I said, "Your thinking is right in line with mine."
So the reason I recommended Dr. Tang for the Wylie Scholarship is that she is an up-and-coming superstar in the world of vascular surgery and vascular research. When I met her, I could see a power that was just below the surface. She's a very devoted, very direct, and very motivated individual, and she's also very, very bright and has some incredible ideas for the future of vascular surgery and vascular medicine.
The one advantage that I have as a surgeon scientist is that I'm sort of more focused on clinical problems that I see patients have, and then trying to find science that will help those patients. The research project is really driven off of a clinical problem that many elderly patients have, which is that they have blockages in their arteries, which lead to insufficient blood supply. In a mild form, it means that they can't walk as far as they might like to, but in more severe forms, it actually can lead to severe pain, even at rest, or to what we call tissue loss or gangrene. Collateral arteries, at best, really can carry about a third of the blood supply that the blocked main artery used to carry. But if we could figure out what makes them grow and what stops them from growing, then we could develop better therapies to make them grow bigger in order to carry more of the load.
The collateral, in simple terms, is the alternative route for getting blood down to the leg. So it is as if you were trying to get home and the main highway that you're driving on is all plugged up and you have to take the city streets. And the collaterals are the city streets that bypass the plugged up highway.
What I'm working on is a specific molecule that interacts with the cell structure as well as a cofactor for various growth factors, in the hopes that by affecting this particular molecule in the future that we could overcome the stop signals that tell the collateral artery that it's grown enough when clearly it hasn't grown enough to help the patient.
The work that Dr. Tang is doing is to understand those factors that affect arterial development and growth of arteries. The reason that that's important is that there are so many people that are affected by peripheral arterial disease that could benefit from therapies directed at the development of collateral blood vessels. And those therapies could prevent amputations. They could prevent significant disability in a large population of patients. So Dr. Tang's research will affect millions of Americans in this country.
When I found out about the award, I was so excited because it was really just at a critical point in my career, and it's for a long enough duration that it will really jumpstart what I'm trying to do in the laboratory. When Dr. Conti told me that I had been chosen as this year's Wylie Scholar, and I just felt incredibly fortunate and lucky at that moment, and it made kind of not just my whole day, but probably the next week and the next month, in fact.